Well, the Centers for Disease Control now saying this year's flu season is now an epidemic, spreading to 36 states. And the CDC urges anyone who hasn't gotten the flu shot to get one as soon as you can. Take a look at this. Several states sadly seeing flu-related deaths. Indiana, they say, has had at least 36, North Carolina 17, Washington State 7. But you know, some doctors are warning that even if you do get the flu shot, it may not even work.
A lot of people that come in did the right thing, got their flu shot or their flu mist, and they're still getting sick. Maybe not quite as sick, but they're still getting sick. We've run into that this week, that they've run out of the Tamiflu medicine to treat it at several local pharmacies.
And this comes as we're learning hospitals across the country dealing with flu patients. So what should you do? What should you expect? And how do you protect yourself and your family? Dr. Devi is an NYU School of Medicine assistant professor of anesthesiology and rehabilitation. You know, Dr. Devi, what do you do? I mean, you get the shot, you try to avoid people. Sometimes you just can't beat the flu.
That's true, but it's still worth it to get the vaccine. And the reason is, I mean, the vaccine, essentially, it's kind of teaching your body how to recognize the flu virus itself. So if you think about it, let's say you take a kid to the zoo and they've never seen exotic animals before, they still might recognize a tiger or an elephant, right? So the reason is because they've seen a picture of it, and that's what the vaccine is. It's basically giving your body a picture of the flu virus. Now, the problem this year is that the forecast wasn't exactly right in terms of which viruses would be circulating. So the problem is, you know, one strain, the one that seems to be affecting most of these folks, that was actually missed. But the vaccine is still protecting you from a whole bunch of other strains. And if your immune system can still recognize the threat, which it still might be able to, it's still a strain of the flu, then the vaccine is still very protective.
So what you're saying is can the flu mutate and change from the vaccine that they've created? And even have vaccines with, like, what, 2 or 3 different types of flu things in them?
Exactly. So a lot of people don't realize that the vaccine has more than one strain of flu. So it has a few different ones. They're kind of like cousins of each other, right? So there's trivalent vaccines and quadrivalent vaccines. It just means that there's either 3 strains in there or 4 strains in there. So you still want to get it. The vaccine, you know, the virus can mutate, that's true. It tries to adapt to whatever we're doing, but it still can be protective. I mean, the other thing to think about is some people are at increased risk, of course. You know, if they have other medical problems, people who are much younger, like kids, people who are older, because their immune systems might be weaker, you know, it's worth having a plan in place if you develop symptoms, what you're going to do. And also there are some medications, antiviral medications. I mean, Tamiflu was one that we just saw, but there are a couple others that you can also use. They tend to shorten the amount of time that you're actually sick from the flu. So if you have any of those medical conditions, it's better to talk to your doctor beforehand. Maybe have a prescription that you don't fill unless you start having symptoms, but at least you have it available to you. That's
a good idea. I mean, I don't want to have a run on Tamiflu, but if you get a prescription and then you think you're coming down with it, you know, try that. Here's a list. We have a full screen of some things that we can do to try to protect ourselves. As you say, get the vaccine today. I mean, the 1 year I didn't get it, forget about it. Forget it. I don't even want to talk about it. Wash your hands. That's a good one. Do the vampire sneeze. That's doing that sneeze in your arm. Just don't, you know, always do it on your hand. Use tissues once and throw out immediately, of course. Avoid sick people. Duh. Don't touch that face and say no to work. That's important because a lot of times you may, you know, you're sick, but you may not want to, you know, call in sick, and that actually does more damage, I guess, because you could spread it to your coworkers.
Sure, and I would add, you know, say no to school, because these are the kids, you know, they're the ones that are most badly affected with this epidemic this year. So the thing is, you know, if your kid is sick, don't send your kid to school where they can actually affect other kids, and maybe, you know, those kids won't do as well either. So.
Yeah, man, classrooms are petri dishes sometimes. Finally, and quickly, the best thing to do, wash your hands, right?
Of course, yeah. And I actually like the vampire sneeze, too, because, you know, what people don't realize is, let's say you cover your mouth when you cough or you sneeze. Okay, you've stopped the spread to other people who are standing around you, but then you go touch your phone or touch your keyboard or your mouse or whatever else.
Yep.
Yeah, the next person comes and touches those things, too. The doorknob, the sink, you know, you name it. And so then they actually get exposed to those germs that way, too.
I hate to swab the doorknobs or the subway pole or any of that sort of stuff.
Exactly.
All right, Dr. Devi, stay healthy. Thank you.
All right, thanks.